my name is Edna Anab. I work with Kasha as the Kenya head lead. So I'll just share a brief journey about Kasha and what we do in terms of health. I know much was already said yesterday by our managing director. So Kasha is a platform where we support women and men and the family to be able to live their best life. Initially, we started off in Rwanda, but now we're also working in Kenya for the past more than 5 years. How it started, when we came to Kenya, we noticed that women have a gap when it comes to family planning. And what we did, we had a focus group discussion with a group of women from the low income, middle income, to find out how we can be able to support them best. One of the things that came out, the women, they're like, we always want to get information about even our menstrual services. We have issues, and we are not able to go to the facility to ask some of the questions because sometimes we are not sick. We just want someone to talk to. So from there, they were able to identify some of the tools that they will interact with it best, and they say that they'll prefer not necessarily going to the facility, but just to reach out to a nurse to chat with them and ask any question at their convenience where they are. Because I know for the ladies in the room, you know, sometimes when you have to go to the gyna, you ask some things, you're like, do I really have to answer it? But now this one gives them convenience. Then from there, we develop a nurse chat on our platform where someone can be able to talk to a nurse wherever they are using USSD platform or using online. And the other tool that they recommended is a tool where women can be able to share experience. So for there, we developed a forum called Community Forum where people can be able to go there, chat about the experience. I've used this and this method. This is my experience. How was it for you? And we also did another tool on where someone can be able to just do a simple quiz. And out of that, they're able to know the best family planning method to use. So after working from there, again, from involving the women and the men, we still identified another gap. As much as we had the products, we have a wholesale pharmacy and we have a retail pharmacy, we also identified another gap where sometimes when they think about going for contraceptive method, they usually stuck, where do I go to? I know the government facility, I know this and this facility, which other facilities are there around me? So for that, where we partnered with Maristops and Penda Health. So once a client comes to us, we are able to refer them for short-acting family planning methods to the nearest facility, any facility that is within them. Still, that wasn't enough. We noticed another gap. Apart from family planning, there is the gyna issues. So from there, we were able to partner with other telehealth consultation platform where someone can be able to get services and also to talk to a doctor, all that part. And as we are doing all this, it's more like a human-centered design where we co-create with the women and you're able to gather information from them. So we also noticed that there is a gap to be able to train where they are heading to get more information. So the next step that we did, we trained nurses, where last year we trained quite a number of nurses across Kenya. We trained more than 200 nurses and 42 pharmacists on family planning method. So right now we are sure the people that we are working with, where our clients are going to, they're already trained. And the other bit that came out through working with private sector, we noticed that sometimes there is a stock out. So right now, our next step, we are working on a pilot project to see how best we can be able to offer credit method to the pharmacies, which is still in the pilot phase. I'm sure there are some of you who are already engaging in this process. And the other current project that we're working on is a pilot project in Kisumu on malaria prevention. So that's just quite a little bit of the step in Kasha. And we'd like to engage with some of you to partner, because in the private sector, we have noticed you can't do it alone. You have to partner with other stakeholders within the field. And we are very open to partnership. Thank you.